Hello and welcome. I'm Dr. Petra Kern, your host for this free 50-minute webinar, Music Therapy and Spiritual Care in Action. This webinar is inspired by the guidebook, Music Therapy and Spiritual Care in Medical Settings, published by De La Vista Publisher. This interactive ebook has been thoughtfully conceptualized for today's learners and edited by Dr. Daniel Tague, Jennifer Townsend, and Stacy Auld. Their expertise and dedication have ensured that this guidebook is not only insightful, but also immediately applicable for professionals in the field. Next, I would like to share a short video capturing the editor's overview of the intention, content, and use of this ebook.
We wrote this guidebook as a tool for students and clinicians in both music therapy and spiritual care professions. There is a lack of research in the overlap of music therapy and spiritual care in the medical setting, but a wealth of experiential knowledge from practitioners. In gathering resources for this collaboration, we realized that we could transform the materials into a single resource that would be useful either as a course textbook or as a guidebook for both new and experienced professionals. This book is a comprehensive exploration of the intersection of spirituality and music, with an emphasis on the clinical applications used by chaplains and music therapists.
From the foundational chapters introducing spirituality as a conceptual framework to the practical applications of the data-based model in music therapy and spiritual care, this book weaves a tapestry of knowledge. It navigates the philosophies of treatment, ethical considerations, and the multifaceted landscape of values, all grounded in the context of diverse cultural perspectives. The subsequent sections delve into the intricate roles of music in evoking spiritual connections, supported by empirical research and insightful clinical examples. The book then transitions into examining the scope of practice, addressing both the potential harm and therapeutic value found in the amalgamation of music and spirituality. Caring for caregivers, end-of-life spiritual concerns, and a culmination of diverse perspectives offers a holistic view of the profound implications explored within the book.
Ultimately, this scholarly endeavor aims to provide readers with a comprehensive foundation, fostering an enriched understanding of the symbiotic relationship between spirituality and music. We've gathered this knowledge and organized it into a guidebook that we hope is useful to both students and professionals in music therapy and spiritual care services. We want to give insight into how these two fields of care intersect in scope of practice, and how music therapists and spiritual care professionals can support, learn from, and work with each other.
Now I will hand it over to my co-host, Dr. Daniel Tague, who has been mainly collaborating with me on this book project earlier this year. We are also fortunate to have authors as guest speakers joining us, each bringing a unique perspective from their own work in spiritual care. Daniel.
Hello and welcome to this informational presentation. I would invite also our other co-presenters to open their video as we make some introductions. And also just a note, we will have a Q&A at the end of the webinar. So if you do have questions, please feel free to type those into the question or the chat. But again, I'm Daniel Tague, Chair and Assistant Professor of Music Therapy at Southern Methodist University. And I have two of our other co-editors with us today.
Hi, I'm Jen Townsend. I am a music therapist and the manager of creative arts therapies at Houston Methodist Hospital. And it was a joy to be a part of this book.
And my name is Stacy Auld, and I am the System Director of Spiritual Care and Values Integration for the Houston Methodist Hospital system here in Houston, Texas. I'm an ordained elder in the United Methodist Church and a board certified chaplain with the Association of Professional Chaplains, and have been serving in a chaplain role for 15 years. We also have with us on the call a couple of our authors of our chapters. And so Ruben Habito is here with us, and he is a professor professor of world religions and spirituality, director of spiritual formation at Southern Methodist University, Perkins School of Theology. And Jonathan Amaya is here with us too. He is a staff chaplain here at Houston Methodist Hospital with specialty in palliative care. So serving with our palliative care team and visiting those patients. He is a humanist chaplain endorsed by the Humanist Society and board certified through the Spiritual Care Association.
Thank you very much, Stacy. We are excited to have so many different professional disciplines and interested parties in attendance today. In fact, it was interdisciplinary work that planted the seeds for this book. And as we developed a relationship with Houston Methodist Hospital to send students there for clinical training, we discovered that our neighbor program on campus, Perkins School of Theology, was also sending students to Houston Methodist for training as chaplains. So we developed the idea of a class where they could learn together at the hospital. For music therapy students, it would count for clinical hours. And although Perkins has graduate students, it worked out that we would be able to have an equal number of music therapy students and chaplain students learning together through class time instruction in the mornings at the hospital, and then practical training on the units in the hospital with professional music therapists and chaplains for an 11-day intensive course. So I'll turn it over to Jennifer, who will speak a little bit more about the beginnings of our journey towards this book.
Yeah, so this collaboration was rooted in a shared mission, as Daniel said, to create a class that would bring music therapists and chaplains together in a meaningful and supportive way. We wanted to go beyond the traditional approaches, focusing on how both disciplines could work side by side to address patients' emotional and spiritual needs. And our primary goals were to foster understanding between fields and deepen the quality of care and help both disciplines develop skills to better support patients holistically. A central component of this initiative would have involved collaborative practice through co-shadowing and co-leading during the class. And by observing and co-leading sessions, music therapists and chaplains would learn to engage with patients in a way that drew on each other's strengths. For example, in one session, a chaplain might provide spiritual guidance, while a music therapist offers entrainment through live music to ground the patient and enhance the environment, creating a seamless experience that would allow the patient to feel fully supported in both spirit and mind. This approach of working together has been eye-opening, revealing how much each discipline has to offer. One of the most valuable aspects has been learning from each discipline. As music therapists, we've gained insights into spiritual care assessment processes, understanding the comfort and significance of rituals that our patients hold. And chaplains, on the other hand, have had the opportunity to learn how music can support emotional release and healing. The reciprocal learning has enriched our practices and helped us deliver more nuanced care. When COVID-19 required us to cancel the course, we decided to capture everything we had developed and discovered by writing this guidebook. So the guidebook is an extension of the class. It's intended as a resource for both music therapists and chaplains, and it's filled with practical steps, case studies, and techniques that we've used here at Houston Methodist, making it a toolkit that professionals can turn to for inspiration and guidance. We wanted the guidebook to reflect the latest and best practices, so we invited clinicians and chaplains to serve as co-authors. Their expertise has allowed us to address a wide range of patient needs and scenarios. With their input, we ensured that the book is grounded in current evidence-based practice that can help any clinician navigating the intersection of music therapy and spiritual care. There is a gap, though, in healthcare resources, as Daniel mentioned previously, and it's related to medical music therapy and spirituality. While we know that music therapy and spiritual care are powerful supports in patient care, there remains a significant lack of resources that effectively bring these two areas together, especially in the hospital. We recognized this gap and wanted to address it, but we also knew we needed a resource that was practical and adaptable. This is where the guidebook became not a traditional textbook. It's or a dense handbook. Instead, we created it as a living resource, something that you can engage in. You can see on the screen a few of those ways that you might engage. So there is a secular music playlist that's accessible via YouTube or Spotify. There's also throughout the book PDFs that can be downloaded to utilize in patient sessions. These practices allow our practitioners to apply different methods during their patient care. We're also seeing increased need for recognition from state and government organizations regarding the potential of harm in unregulated practices. And this underscores the importance of providing resources that are based on solid evidence and best practices. So our guidebook aims to offer that reliability, setting a standard that others can follow to ensure patient safety and effectiveness in a therapeutic use of music and spiritual care. We hope to receive additional testimonials and information from people as they read the book. So far, we've had good responses of those that have been able to resource it. We encourage you to check the book out for an in-depth assessment of the guidebook's impact and value and how it might assist you in your work.
Thank you very much, Jen. Especially for our faculty who might be in the audience, I wanted to briefly speak about how we have integrated the book into our curriculum. So we have a group supervision class for all of our second semester through seventh semester students each week, where we touch on topics related to clinical practice and practicum. One of the books we already use in this class, also available from De La Vista Publishers, is Dr. Jane Stanley's Evidence-Based Practice in Music Therapy, Transfers from Research to Clinical Settings. And we rotate through chapter topics for student presentations throughout the year. We have now added in the new Music Therapy and Spiritual Care in Medical Settings guidebook to the mix for student presentations. And recognizing the need to reduce book costs for students, this book will also serve the students in the medical populations practicum companion class to their clinical rotation in the medical setting. So in fact, the reader engagements that we have at the end of the chapters have been perfect for the classroom presentations and help with more of that flipped classroom model. For example, we've used the embedded video and scenarios or the vignettes in the Understanding Spirituality reader engagement during class, as well as exploring example scenarios from the section that discusses the potential for harm through using music in a medical setting. And we have the idea that future presentations will likely use the resources in the book to discuss interdisciplinary team issues and other things from our Certification Board of Music Therapy board domain areas like treatment planning, such as collaborating with other professionals and our family, evaluating the role of music therapy within the overall therapeutic program, and other domains like the professional development and responsibilities, where you're supposed to engage in collaborative work with colleagues and maintain professional boundaries to ensure competent and ethical music therapy practice. So we have lots in store. We're really excited to continue using the book. We've also invited our colleague Ruben Habito to mention some of the places where the book might fit well into student work in the theological seminary. Go ahead, Ruben.
Yes, thank you. My role in this cooperative venture of bringing out this book is to offer some perspectives on spirituality and spiritual formation and how it may be connected with the students where I teach at Perkins School of Theology, especially those who are preparing for chaplaincy roles. And so this book is really addressing precisely that kind of task. And so first, I would like to offer a clarification about our understanding of the term spirituality. Many of us who have been raised in the Western cultural tradition may think of spirituality as the realm that is distinct from the physical or material aspect of our existence. But that is what needs to be corrected. There is a book or a series of books published by Crossroads Publishing that has the general subtitle of World Spirituality, and the different volumes are contributions by scholar practitioners of the various religious traditions of the world. And before they set out to write the actual contents of the book, the editors got together to consider or to consult on what they would be able to understand as a common working definition of spirituality. And so precisely to counteract this tendency of thinking of spirituality as something above or something of a different dimension from our physical, our material, or bodily life, their common definition that they came up with goes like this. The spiritual is the core of the human person, that innermost core where, as one enters into that core, one encounters the transcendent. And to add to that, the place where one also encounters one's interconnectedness with all beings. So in that regard, when we use the word spiritual, it does not refer to a plane above the physical or the bodily aspect, but precisely is an integrative word that unites the whole being, living being, at the core of our being itself. So with that then, spiritual care means caring for the entire being. And so these aspects that are part of healing, especially if there are individuals, or there are many individuals in our world today who are in a situation of illness because of trauma or because of so many other factors, physical and psychological and so many other factors, then the person who is offering ways of healing, including the music therapist or other kinds of therapists, need to have that whole picture of the human being in their own frame of mind. And so with that, the chaplains that, for example, are part of this class on music therapy and spiritual care also learn from those who are practicing the therapy of the individuals through the various methods that they are offering, but also are able to see how they themselves need to learn about those ways so that they can incorporate them in their ways of ministering and caring for others. The word therapy, by the way, in Greek is from the verb therapeuein, which literally means to care for, to minister to, and thereby by extension to treat and help in the healing of. So in that regard, we use the word therapy now in contemporary English as a word that relates to attempts at providing ways of healing. And that healing is not just on the surface level, what concerns our physical and psychological aspects, but it also affects issues of ultimate concern, that which comes to our spiritual core. So in that regard, those who are preparing for chaplaincy will find very much to help them in this book. So I would like to just note that, and grateful that it came out. And so it can be a multidisciplinary resource for people whose task in their life or whose mission in their lives is to really be of help in the healing of persons. So thank you for allowing me to be part of this collective and creative endeavor.
Thank you, Ruben. I think my slide is next to talk a little bit about how we imagine this book being a really good resource for training chaplains. And Ruben talked a little bit about it from thinking about it inside of seminaries and some different training, practical training there. And one of the ways that I imagine this book, guidebook, being used and think about as through training for the profession of chaplaincy, which starts, the formation part of that starts in a seminary type setting, but then moves into a very practical setting. We have most chaplains that are seeking to be board certified chaplains have to participate in an accredited program called clinical pastoral education. And this is an accredited program where each unit consists of 100 classroom hours and 300 clinical hours. And it's designed to give students a supervised experience in a setting like a hospital where they embrace this action, reflection, and action model of learning. And one aspect of their learning is having to practice collaborating with other disciplines in the hospital. And so in the way that this book highlights that specific collaboration between chaplains and music therapists, it's a really good example of one of the many ways that chaplains need to lean into that and to collaborate. So CPE, clinical pastoral education, is an opportunity to learn. It's another opportunity to learn kind of what tools a chaplain might need to have in their toolbox. I think this ebook gives a lot of really specific tools that they could add. And specifically when caring for a really diverse population. And CPE is also this opportunity to practice different interventions for effectiveness. And again, some of that is highlighted in this book that may give some ideas. So really practical in chaplaincy training that ultimately is going to prepare them for board certification. I have a unique kind of lens right now in a role that I am serving for the Association of Professional Chaplains. I'm serving as the chair of the Commission on Certification. And so we're a certifying body that is certifying chaplains across the nation. And it's existed for decades, and there's been lots of chaplains being certified throughout the years. But in my last 3 years of being the chair of the commission, we've been averaging 400 chaplains a year that we are certifying. And so when I think, and then when I reflect on the different competencies that we are looking for and what it takes to be a board certified chaplain, we have identified 29 competencies that have to be articulated and demonstrated for somebody to become a board certified chaplain. And there's 2 of those 29 that are, to me, very specifically related to the work that we've done in this guidebook. And one is that we require demonstration of a person to provide spiritual care that incorporates a working knowledge of an academic discipline that is not explicitly religious and spiritual. So to gain an understanding of the discipline of music therapy and what that takes and what that looks like and how caring happens through that academic discipline that's not our own theological discipline is an important demonstration that we require. And so this book could really be helpful in helping somebody understand a completely different discipline than our religious kind of theological discipline that is also required for us to kind of be able to articulate and demonstrate. So that's one of our competencies that I think this speaks directly to. And then a second competency that we have is that we have to demonstrate that we can establish and maintain intradisciplinary and interdisciplinary relationships. And so again, that's what this ebook is all about, is highlighting that relationship, that collaboration, seeing how we learn from each other and benefit from understanding each other's discipline for the benefit of how we are caring for the patients. So when I think about the future of this ebook, I have a lot of work to do, I feel like personally, to make sure this gets introduced to our CPE educators. There's lots of institutions, there's seminaries across our country that are developing chaplaincy specific degreed programs that I think that this would be a fabulous addition to their curriculum to think about adding. So I think that putting this ebook in the hands of people who are training chaplains specifically is a really good place for this book to land. So I look forward to seeing the new places that we can introduce this resource for that chaplaincy education.
Thank you very much, Stacy. I'm going to jump in and just kind of introduce Jonathan and his slide. So I mentioned before that we've been using some of the reader engagements in our student presentations in our class. And so we wanted to invite one of our chapter authors, Jonathan, to give an example of what might come out of doing one of the reader engagements that he helped to create from the chapter that he was co-author. So I'll turn the time over to you, Jonathan.
Thank you so much. Yes. Well, I guess it's a good thing that we can turn the focus into the reading engagement exercises that the book has to offer for the reader, right? That will allow to explore and gain a deeper understanding into what goes on in the care that we provide as spiritual care providers, and also how it intersects with the music therapists, right? So the exercise that is in the chapter that I co-wrote, it explores, right, the different aspects of care when it comes to end of life. And it focuses on the goals and the interventions on this crucial moments of life. So there is different sections there. For example, the life review, the relationship closure, anticipatory grief. And I wanted to explore a little bit more on the advanced care planning. And I wanted to bring an example of what it would look like for the reader to engage in this and create a vignette that will reflect on the objectives, the goals, and the intervention of the activity, right? And this reminded me of an example in a case that I experienced a couple of months ago, where when they had to do a encounter with a family and a patient where they needed a time to reflect and explore the advanced care planning of the patient. The patient was very worried that the family was not being faithful to what the patient was requesting for the future. The patient was very concerned about the family not, taking to an action to what the patient was requesting. So we had to explore, right, and make sure that we were exploring what the patient was defining as quality of life, and making sure that the family was understanding that, and then making sure that they knew what the advanced directives are in place or available for them to put in place and fill out. Once we realized that there was a living will and a medical power attorney in the conversation, we facilitate the opportunity for the patient to fill out and designate someone to be the medical power of attorney. That ended up being someone that was not part of the family. This was a very tense and very complicated conversation and encounters, right? Because there was multiple encounters when it came to this. But it ended up being a very good approach and outcome afterwards, when we were able to find a person that was appropriate for the person and take those medical decisions in the future, and that it was going to be faithful to the wishes of the patient, regardless of what the family members would want. So when it comes to that, putting that together as a vignette, putting at the objectives there, the goals of what the whole encounter has to do, and then also the interventions, right? When it comes to the role of a chaplain, for example, on this one, and also what I encounter in the with this family and this patient, right? The chaplain acts as that listener, that sounding board for the patient and for the families. And also not only there to listen to the conversations and the concerns, but also to guide, in a sense, to ask the right questions, to help and bring that autonomy back to the patient, and make sure that they are the ones taking control, and they are reminded that they're still the captains of their own boat, right? And of course, when it comes to the music therapists, they help to build the legacy and manage the emotional and physical pain through personalized music interventions, focusing, connecting with, and reflection. So this is some of the things that are available for the reader as they go through the material, and a very brief example of how it can happen. So yes, thank you.
Thank you very much, Jonathan. Yeah, we hope that you found some interesting aspects that might speak to your position and to your role, and how the book might be useful to you. And so we tried to bring together all these different, so many different people in different positions at the hospital and in education to figure out the best way to present the materials. And so we do invite you to get the book if you want. There is a $10 discount through the end of day tomorrow for you as attendees. You can scan the QR code if you want to go directly to the website. If you are interested in obtaining the book, we also have a slide in just a minute that has a QR code for a webinar handout, and it will have some of the links on there for you. Some things looking ahead. If your library, we've had some institutions who want to add the book to their libraries, and if your library wants to purchase the book, they can offer it in read-only mode as a reference book, or simply just set it so that it's not allowed for circulation. So that is some questions that we've had about that. But we do hope that you will share this resource with your colleagues, friends, and families. It really is designed as a guidebook, so it's not really a textbook and it's not really a handbook, because it's presented in an easy-to-read style and includes references if you are interested in further investigation. And we hope to hear from you about what you've learned from the book and how it has been helpful to you in your work. We will be hopefully, we have plans to provide more information and more insight as we're learning and using the resource at future conferences that will be coming next year. And here is a QR code if you want to scan this. And I think we're also putting that into the chat. I would have to look at the chat, but hopefully somebody is doing that for us. Yes, okay. If you can't scan the QR code now, look in the chat for a link so that you can get the handout. And on the handout, it does have the link for the Interfaith song list, as well as the link for purchasing the book. And I think now we do have some time for questions, and I know we've had a couple of hands raised. I'm going to leave this up for just a minute in case anybody wants to scan, and then we are going to end the presentation so that we can see what questions you have, and we'd love to answer your questions.
Thank you, Daniel, and all speakers. I see that Cindy had her hand up. I ask you, Cindy, to put your question in the Q&A so that we can manage it better and then answer it and see who of the speakers is going to answer your question. While everyone else is hopefully also thinking about the question and is coming forward with it, taking advantage of having the authors here on the screen with you and having firsthand information. I have a question for you. Since I have produced the book for you and put the concept together, I read really every word. And, for me, it was very interesting. First of all, the topic, because it's not something we really all speak about. You are really in a situation in a workplace where it's very sensitive what you're doing and confidential and all that, and bringing this out for everyone was highly interesting to me. But my question for you is, since this is a truly interdisciplinary book or content, what we actually do always in our work, interdisciplinary work, but you brought it together and respecting and honoring each other's work and showing how you do this together. What did you learn from each other through that project? What is one of the things you were surprised about the other profession?
Well, I'll go first. I think we found out as we were comparing the standards of practice, we did find out that in the world of chaplain, there were some competing, or not competing, but there were some different pathways for chaplains. And so it was very interesting kind of matching up our standards of practice and putting those side by side and kind of seeing they were very similar, but we just had a little bit more very specified code of conduct standards of practice, and the chaplains were not as specified. And so it was just interesting to find that out, that they were very similar, but they just think of it in a different way. And so that was something new for me.
I think one other thing that was helpful for me to see too is in chapter 4 talks about the database model of music therapy, and then right under it is what we've called the stages of a chaplain visit. And that stages of a chaplain visit is not a standard like written thing across our profession. Like nothing like that had ever really been put to paper. It's like we all kind of know like the beginning of a visit and the end of a visit and some things that happen in between, but seeing that the music therapy profession has something very specific that kind of talks through that database model, and then being able to write something that when we looked at it, we're like, well, chaplaincy has a very similar kind of flow of how things go. We just haven't ever, to my knowledge, it's not clearly kind of stated as a professional standard in the way that the database model for music therapy is stated as a standard across the profession. And so that was an interesting thing to see, that we have something like that in practice, but it's not necessarily written. So we kind of took a stab at writing that in this ebook.
Yeah, there were kind of two phases. Oh, sorry, Jonathan, you were going to go. There were kind of two phases of discovery, I think, for me. The first phase was just those early chapters where we were sitting down and having these meetings as large teams, kind of looking at the information and how it all fit together, like what Stacy and Daniel are talking about, and just learning about the backgrounds of the professions, how they came to be, what were their history, what does it look like in development of the professional, what does the profession look like in terms of the profession's values and ethics and guidelines, and all of those pieces weren't something that I was aware of. I mean, I assumed that chaplains had them, but it's not like I went and read them before, right? So reading them was really, or looking into kind of what that process was for chaplains was eye-opening to see that the overlap and similarities and the differences. But then the second piece was the actual clinical work and hearing from the clinicians that were writing book chapters coming together and saying, well, this is what it looks like when I go in and do this type of session. And this is what it looks like when I go in and do this type of session. And what we learned from each other and how we can embrace some of those pieces and try to put them together and spearhead conversation for moving things forward and developing new ways and bringing different things to life. I think there's an opportunity for that connection and accountability within that. And so there was just these two phases, distinct phases in my mind of learning this background and then learning the clinical side that came to be.
Yes, for me, I feel that I resonate quite a lot with what we're talking about, the merging, and it's something that in a sense it's in our heads, and at least for the chaplains, we kind of are aware and very conscious of whenever that happens, especially when we're collaborating in one case. But I feel that it brought more clarity and shed more light for me when I was co-writing with the music therapist at the time, and how both of our practice and our disciplines kind of touch and merge in that aspect of the person, where it touches the existential aspect, the belief aspect, their tradition, their culture, and it's something that the music therapists and the chaplains are able to tap into those things, perhaps at the same time, but from a different perspective in practice and service, which to me, writing and elaborating and talking about this with the music therapist brought more clarity and more insight into that moment of providing support from different disciplines. So yeah, to me that was really neat.
And if I may add to that, from the perspective of those who are preparing for or who are engaged in chaplaincy, to actually know that there is a realm of healing that words may not be able to address, but through something that touches the depths of their being, namely music, somehow some things can be stirred towards a new wholeness. I have a friend who is a practicing music therapist, and she goes to nursing homes and hospitals, and a good number of her clients are persons who are in either medium or advanced stages of dementia. And so where words do not really affect such a person, if you talk to such persons, somehow the words that you address don't elicit a response. But when she plays music to them, especially the kind of music that she would know are somehow along the time of the patient's age, then somehow there's a resonance, and she's able to bring forth some responses in a way that enables her to connect with her clients. So I believe that music therapy has a very, very special and specific contribution in healing that chaplains also should know about.
Thank you, Ruben. If I may also state what interests me in the book, I'm a music therapist, and I'm coming from this perspective. I think what really gave me a lot of information is you have created a table in there about the world religions, from Buddhism to Islamic practices. Every world religion was listed there, and looking what are the belief systems, the philosophies behind how is actually certain topics are seen from a healing perspective or from a music perspective. Is music being something central in that culture and so forth? That was very helpful for me to see, especially in a world where we are right now, where we have to understand each other's belief systems and where we come from. And what you said, Ruben, bringing it beautifully together, what's all behind us, it's actually spirituality and not a specific religion, right? A specific belief system. And Indra Selvaraja, who resides in Singapore and is from Malaysia, she also sent us a note to us hosts and said that this is an excellent and timely resource. She is the chair of the Global Crisis Commission of the World Federation of Music Therapy, and acknowledges that it's important to know diverse cultural perspectives on spirituality for patient care to actually be effective in our services to our clients. So I thank also all for your answers. We have another 6 minutes, and I would like to invite our attendees, the participants, to post their questions. Cindy, you still have not told us what you're interested in. I hope you will still put this in the chat or in the Q&A for us. One person is asking if this webinar is recorded. Yes, it is recorded. And if I find time, I will edit it and put it on the website for those to look at it asynchronously when you have time to do so. All right. Are there any other questions you want to ask each other?
Well, I just wanted to reiterate what you were saying, Petra, about what Indra was asking about, because I think both you and Ruben kind of really touched on that, because I think that it is important that we're talking about spirituality from the perspective that it's from this idea of holistic healing, and that everything about us is part of that healing process, no matter where your spirituality, where you find your spirituality from. And even though we do mention some things in the book about certain religions, we definitely are talking more about the sense of a higher being, and how that really comes into play between the music therapist and the chaplain.
And I think, and Jennifer, you might be able to speak more about this or to this, especially when you're in a situation of the clients you are seeing on a daily basis where they face maybe terminal illness or end of life, or you're not being sure how the life will continue, that you're hoping and you might pray or do spiritual practices to get through the situation, right? And talking about this, Stella Patras, hi Stella. I remember you have been a student of Daniel, right? I had you in some of the guest lectures, so you have been actually an author of Imagine. You say, thinking back to when I was a music therapy student, I did not consciously consider the role of spirituality in music therapy. And even now, it's still a new concept to me. For future music therapy students and our music therapists, is there a section in the book that helps the music therapy student or MTPC understand their own opinions and thoughts, concepts on the role of spirituality in music therapy? And Stella, I think this is a great question, because in music therapy, we always say, that we should not bring our religion practice into our daily practices and respect what everyone is coming with. And so it is probably a good thing to think about it. And I think the authors can speak to that.
Yeah, there's actually a really cool reader engagement in one of the chapters about a music autobiography, where you're creating your own and you're incorporating not only spirituality, but your own musical history into that musical autobiography. And then there's some other reader engagements about exploring your own spirituality and finding out where you live in that.
And the question is about which particular section of the book addresses those issues of spirituality. And I would say it's in different sections of the book. So my suggestion is to really look at, get an overview of the book, look at the table of contents, and then go to those sections that address those specific issues. And I think the headings will be helpful in giving you a sense of where they will be.
And I think secondary to that is the practice of understanding where you sit spiritually, but also how music is a part of that or not a part of that. And so, yes, for the music therapist to really understand their spirituality, where the chaplain may already have done a lot of work in that area and the music therapist may have done less. The vice versa is true, where the chaplain may not realize how impactful the music has been or has not been in certain situations that they've been a part of. And so there's contemplation opportunities for that as well.
And we have one more question from Chris saying, would you say the case studies are focused on individual care cases, or would they also be applicable to congregational care group settings? Is this a chaplain question? I think, Stacy, that's one for you, no?
I'm not sure. I don't want to say something that's not true, because I'm not thinking through all of the reader engagement exercises. If they're more kind of individual focused or kind of group focused, was that the question?
Yeah. Well, there are lots of vignettes interspersed in the book about little situations that talk about it, especially, a lot of little vignettes, but in the reader engagement, there are some activities for groups to work through. So definitely, I would say both are represented in the book.
I would say, though, that the book is meant for the medical care setting. So the focus of all of those interventions are in the medical care setting. They might be adaptable, and you may be able to bring other experiences and knowledge from your own practices to change them and use them in more of a group outside of the hospital setting, but they are focused on medical.
That's a good.
Yeah, that's something I was going to mention. It would be a great tool for also use it as a reference for trigger ideas and bring it into other contexts as well. It could be not just limited to those specific contexts. Yeah.
Sure.
And What I also want to mention is Jennifer actually interviewed all the authors and asked them about cases uh, where they worked together with a music therapist and how that worked in a certain case. So if you need case vignettes, there are videos and interviews, and they're all being done in the beautiful chapel. And you see actually the book here, the colors is actually the glass of the windows of the chapel, which we made a cover of the book because we all liked it so much. And so this is another way of looking at it by looking at the video materials in the book and having this as a discussion or as an example for your own work. Is there anything else you want to close with, Daniel?
Just, please find us at a future conference, email us, be in contact with us. We'd love to hear your thoughts and further questions that we don't have time to answer today. Thank you very much for coming.
So I also want once more thank our speakers today for this valuable contribution, and thank you all for joining us, for being part with us for this conversation on music therapy and spiritual care in action. I hope you found today's webinar both inspiring and enriching, and I wish you all a very good evening. Thank you very much. Bye-bye.